Before I joined Bluetail, I worked as an emergency medicine physician for 10 years. And I was a flight paramedic way back when and had a lot of injuries. I have a fairly strong family history of arthritis and collagen problems, so for me it was sort of a necessity that I find something that can offer relief besides steroids and surgery. I did my sports medicine fellowship after my emergency medicine residency in Pittsburgh. Learned quickly that there are things in the regenerative medicine sphere that were developing at that point that we should pay attention to. Taught at Barnes for a few years, and unfortunately at that time and even today, the established bastion of healthcare in the bigger centers, they still don't really use regenerative medicine well. So that's when I started Bluetail Medical Group 12 years ago.
I did my residency and my sports medicine fellowship at the University of Missouri in Columbia. And after I finished that, I spent about half my time doing emergency medicine and about half doing sports medicine. So about 30 hours in the ER and 30 hours doing sports medicine. And did that up until probably about the age of 35. And at 35, I decided that I was too old to work 60 hours a week. So I decided to go back and just pick one. And sports medicine obviously was what my love was and what I chose to do full time. I joined Dr. Crane at that time in his office here in St. Louis part time, and then eventually opened an office in Columbia and then stayed here as well.
So I graduated from St. Louis University Medical School in 2001, and then I was on a Navy scholarship for medical school. So I did my training through the United States Navy. In San Diego, I did a pediatric residency actually, and did my payback, and then I got out and did a fellowship in primary care sports medicine, and after that got a job here in St. Louis at the Orthopedic Center of St. Louis, where I got a lot of great training from fellowship trained orthopedists on advanced sports medicine surgical techniques. During that time, I was working informally with Dr. Crane and Dr. Oliver, collaborating on some cases, and then when I felt the time was right, I asked to join their practice, and then I joined at then was Crane Clinic, which became Bluetail Medical Group.
I left the clinical medicine and teaching roles at the university settings to form Bluetail Medical Group, principally because that was the very early stage of regenerative medicine, and we were just at that point seeing the new technologies come out, and there wasn't enough really evidence-based medicine to support at that time, literature to say that we should be using these protocols.
So I joined Bluetail Medical Group in 2011. I joined because I was looking for something more. Before I was doing these regenerative treatments, I knew that there was a window between just simply doing nothing and waiting for the pain to escalate and doing a surgical technique. And I think we fill that window very clearly and very appropriately, and I knew there was something more out there. So when I was able to find that through Dr. Crane and Dr. Oliver, I felt like I was coming home because I felt like that was the most aggressive, appropriate treatment I could give my patients.
I joined Bluetail in 2008. Dr. Crane had been a good friend of mine. We both had worked in the ER together, moonlighting, and both of us had a sports medicine passion and background. So I had a clinic in Columbia, and he had one here in St. Louis. So I began working in the St. Louis clinic.
I started Bluetail Medical Group because there were a lot of patients who needed support for their tissues, whether it be meniscus or collagen or tendons or ligaments, that weren't good surgical candidates, because there's a lot of things that we don't have good surgeries for, and there are a lot of things we have good surgeries for, and we wanted to fill that role on what we could do did not require surgery. So non-operative sports medicine is where we put our niche. And we had a lot of patients in that sort of endurance world that needed help with chronic tendon and ligament and joint problems that didn't want surgery or couldn't have surgery.
We treat a whole gamut of musculoskeletal injuries.
In fact, there's probably not a lot of tendons or ligaments or joints that we haven't approached from treating it with regenerative medicine.
It can be anything from a soft tissue injury, such as a tendon partial tear, to plantar fascia problems, to an Achilles tendon, to a nerve issue, such as carpal tunnel syndrome, and all the way the spectrum to cartilage disorders, including osteoarthritis, meniscal tears, diseases of the spine, lumbar disc disease, and arthritis.
We treat those ailments because they create a lot of chronic pain for patients.
I have a pediatric background, so I feel very comfortable treating youth and young adult, both overuse and traumatic injuries. People ask me all the time, how young have I treated with regenerative treatment options? I've treated high-level high school athletes. They do very well. I think they heal quicker than anyone else. But then one of my favorite areas of care is the young adult with a traumatic osteoarthritic condition. Let's say they tore their ACL and continued to play, and within 5 years they start to see some osteoarthritic pain creep into their knee, for example. So this is a patient in their mid-20s and they're already having bad knee pain. We feel like we can step in and use their own stem cells and help keep them out of the operating room for quite some time and hopefully permanently.
So most things are going to recover from inflammation within 2 weeks. If you're not recovering after 2 weeks or a month or 6 weeks, then normally you're in that degenerative tendon or collagen issue. Those are the things that we're going to go after to treat with regenerative medicine, and that's where we really find that patients gain the most benefit.